Hello, I'm Dr. Hobson, your Health Empowerment Guide. Today's vlog will be concerning the prevention of lower back pain, which is extremely common, more so in our country probably than most because of our lifestyles. This vlog will have three parts. I'm going to first explain general philosophy about the American healthcare system, and then I'm going to show you the anatomy of the discs and what happens when we do things that causes degeneration. The third part of today's vlog will be exercises and proactive things that you should be doing every day to prevent lower back pain. So first of all, just a brief note about the American healthcare system. Our general philosophy has been to treat disease and to wait until the patients are suffering with some types of symptoms that brings them into the doctor's office, and then the doctor usually will pull out his prescription pad and write some kind of script or prescription. It's interesting that the United States is ranked one of the lowest countries of all industrialized nations in their overall health. In fact, they're rated about the lowest of the industrial countries. Look at other countries that have similar quality of life. It makes one stop and ask, why are we rated the lowest? If you do a little background research into this, you'll find that pharmaceutical companies really sponsor and pay for a number of our medical schools. They do a lot of the funding there, and they also introduce some of the curriculum that are taught to the doctors, which end up creating some prejudice in their thinking. Also, the continuing medical education in our country is sponsored by the pharmaceutical companies. It's interesting that in our country, the doctors end up making far more income when their patients are sick and have symptoms. And so there's some problems going on where our paradigm is to treat disease and not promote health. In other countries of the world, such as Singapore, they're rated as one of the healthiest countries in the world, along with Japan and Australia. These countries, when a patient goes into a doctor's office there, and the doctor writes for a prescription, I want you to walk more, I want you to start eating a healthier diet, such as a Mediterranean diet, I want you to do daily stretches. And so the way that they treat their patients is by preventing disease and not trying to treat the symptoms, which I've always felt is a much better way of practice. That's the way I have tried to teach my patients for the past 40 years. So back to today's topic, preventing lower back pain. First of all, the anatomy. I want to show you what's called a magnetic resonance image of what a herniated disc looks like. You'll notice there's 5 lumbar vertebrae. The L5 disc in this particular image, you see it bulging outward right here. This one not hardly at all, but this one's bulging out quite a bit. The same picture as it relates over here shows a nice smooth disc, and it's bulging out right here. This line relates directly to this spot here. So that's what a herniated disc looks like. The discs are supposed to have a certain amount of vertical height, plump or thickness to them, and you can see this one is in trouble. Now let me go over to my chart and show you a little bit about the anatomy of a disc. So this is what that disc looks like from the inside. This would be the front of the disc. Out here at the front of the vertebrae, these little discs, the front and the rear of the disc. So back over here, this is the front of the disc, this is the rear of the disc. The center of the disc, which this doesn't represent very well, has what's called a nucleus pulposus, while the outside of the disc, called annular fibers, is the annulus fibrosus. When we sit, often we sit with our backs slouching forward like this. When we slouch forward, it puts more and more pressure on the front part of the disc driving the nucleus pulposus backwards. It drives the pulposus backwards, and it starts to create annular tears in little fibers. As the front part of the disc gets compressed down, it drives the nucleus pulposus forward, creating little annular tears. Over time, over decades, these tears get larger and larger until they start to extrude through the posterior portion of our discs. There's a strong ligament that prevents them from extruding in the center, so they often extrude on what's called posterolateral portions of the disc. On the MRI, that's exactly where you see the disc protruding, is over on that patient's left lower back, starting to compress nerve tissue and thereby creating symptoms. So how do we prevent that? Usually it's associated with the posture being maintained in the lumbar spine. So when you're driving a car, it's better to have a little bit of a lumbar support so that the back is not like this and supported more like this. That will keep the pressure off the front of the spine, driving the disc backwards. So when we sit, a lumbar support is helpful. Also, stagnation, just sitting in place, will cause the disc to slowly lose fluid, called desiccating. Over years and decades, loss of normal motion here will progressively cause disc height to get narrower and narrower as the discs start to tear and bulge to the back of the spine. So simply getting up often out of a seated position makes a big difference. I recommend it to my patients that have sitting jobs, which a lot of us do, probably most of us do. I recommend they just simply get up for maybe 30 seconds every 15 minutes. And when they get up, just rock their pelvis from side to side 3 to 5 times, bend it forward and backward 3 to 5 times, rotate it 3 to 5 times, taking about 10 to 15 seconds, and then sit back down. But use their smartphone or their smartwatch or some little timer to simply get up every 15 minutes. The last thing I want to talk about is proper ergonomics in lifting. A lot of us lift wrong. So when we lift, we want to maintain our lower back being straight. You'll notice when I go down, simulating like I'm going to lift something, my back stays straight. I pick the object up and use my legs to lift with. Most people don't do this. They start to go down and then they bend their back forward. You see what's happening to my spine? I'm now driving my disc backward. By compressing the front part of my spine, I'm driving the discs backwards. This is often what quickens a disc herniation, is lifting with your back and not your legs. So I try to encourage all my patients to lift with their legs and not their back. Now, a lot of my patients say, well, I can't go down like that with my legs because I don't have the flexibility in my hips, my knees, or my ankles. So we simply teach, do exercises to get flexibility back in your ankles, back in your knees, and back in your hips. So flexibility for ankles would simply be standing against a wall and pushing your leg back. A lot of runners do this to get flexibility back into that ankle. To get flexibility back into the quadricep and hamstrings, a lot of runners do this, where you try to get your stand straight, get the stretching knee back by the other knee, and then pull your ankle towards the gluteal muscle until eventually you can get it right up to the gluteal muscle, which is elongating the quadricep, getting your knee more flexible. The other stretch is sitting on the ground, reaching towards your feet to elongate the hamstrings. As your legs become more flexible, you'll notice my ankles and feet are staying flat on the ground. And you'll also notice my back is staying quite straight. I have flexibility in my ankles, my knees, and my hips. I now can grab an object and lift with my legs and not have to lift with my back. So even when you lift your body weight, even when I'm picking up a feather, my lower back is having to lift about 90 pounds what my upper body weighs. So even lifting a feather, you should try to always use your legs to lift. If you'll start practicing this, getting flexibility back in your hips, knees and ankles, and start sitting less amounts of time, getting up every 15 minutes for a 30-second stretch. Use a lumbar support while you're sitting. You'll find over time your low back pains will start to get less and less and less, and you're actually going to be able to prevent a lot of lower back pains. So until next time, this is Dr. Hobson, hoping you can be empowered by this information and start becoming proactive, doing the things you need to do to stay healthy. Thank you.